What do I mean by come off the fence?
Stick to one diagnosis.
Stick to one diagnosis. I don't think I really mean that. No.
Mm.
What if someone comes in and there's three possibilities? Okay, let's say I've got some shortness of breath. I've got some shortness of breath, all right? And actually you think this could be, number one diagnosis is chest infection. Number two is a clot in the leg, clot in the lungs, but they haven't got any DVT features. And number three is it could be heart failure, but they don't really have it. They've not had any chest pain and their ankles really aren't swollen. All right. And you think the best thing to do, the best thing is, Mrs. Such said, this could be a number of things really. It could be coming from your heart or your lungs. And I think the best thing to do is to bring you in for an examination. All right. And when you come in, the doctor will examine your heart and your lungs to see what's going on there. Is that okay? You'll be happy with that? Okay. Okay. So coming back to this, I've written down here, come off the fence. What do I mean by come off the fence?
Is it like be vocal about what diagnosis you're trying to fish out with the investigations or exams?
Well, it's something like that. I think what I'm trying to say is if you've got three things, you normally don't think of all three things normally don't have the same importance, do they? There's always a differential diagnosis number one, there's then the differential number two, and then differential number three. And sometimes differential number two and three, you don't really think about at all. You're just being precautious. You think it's mainly number one. So when I mean come off the fence, I mean don't sit on the fence and explaining all three things with the same emphasis, like as if they're all equal. What I'm saying is pay most attention to the first one, still explain number two and three, but put them down to marry with what you're thinking. However you're expressing it should marry with your worries, right? So there's no harm in me explaining that we need to check the heart out as well. We need to make sure that there's not a clot, but I should put the emphasis on the chest infection because that's what I think is going on. That's what I mean by coming off the fence. In most situations, you can come off the fence. There's a few rare situations where it's difficult to come off the fence because you need more tests and investigations before you can work things out. But most things you can work it out. Right. Abra, coming back to your point, yeah, the chest pain lady, that's what I was saying to you. If we had done a good job of data gathering, you would have realized that this isn't really cardiac. It's more likely anxiety. All right. And that you're doing the cardiac stuff as a precaution. So on that consultation, to explain the cardiac stuff with such emphasis would be wrong because that's not matching with what you're thinking in here. You're thinking. So if we look at your thinking, and we'll put your thinking in a cloud, is this sounds like anxiety. And let's say you did explore it and there was no big features of IHD, ischemic heart disease, and there's no features of PE, and you just think, actually, I think this is anxiety. All right, but there are features of anxiety. She's going through a divorce, and let's say there's lots of work problems and all that sort of stuff. And let's say there's paternity fights. All right, so you know mostly it's anxiety, but you still think in the back of your mind, okay, there is just one thing I just want to make sure, and I want to make sure it's not ischemic heart disease because her dad did have a heart attack at the age of 55. So I'll make sure, just double sure that that's not happening. And she does smoke. All right. But I can't find any proper ischemic heart features. It doesn't go down the arm. She says it's more like a sharp pain rather than a tightness. And also you think even smaller, you think it might be a PE, but I just want to make sure. Yeah. So those are your three areas. Yeah. This one, which is big, this one, which is small, and this is. But if you now go and explain all three things, and this is your explanation, with the same level, that's wrong, don't you think? That patient wants to know what you're thinking. That patient wants to know what you're thinking. And if you're thinking this, then why should you give this the same emphasis and that the same emphasis as this? And if you are thinking this and you explain this and that in the same emphasis as that, don't you just create a lot of worry? You do, don't you? So I'm not saying you don't explain this at all. I'm not saying you don't explain this at all. I'm saying explain it to the same level as your worries. So someone give me an example of how you would explain this then.
I would say that, well, thank you for sharing this information with me. from your description, I do feel that these symptoms that you're having, or episodes you're experiencing, are less likely to be because of physical cause, and it might be triggered by some like anxiety or anxious thoughts that you were having at the time.
Mm-hmm.
Having said that, I would like to do some few tests just to make sure everything else is okay, because you mentioned that your father had some heart disease in his 50s.
Yeah.
Ask them if they agree with that, or if there's anything else that they want to.
And Abra, I think that's really, really good, because you emphasize, I think this relates to anxiety, and you are doing some extra tests, but you put it into proportion. I'm just doing that just to make sure, but I might even take it a step further, and I might say, but I do expect them to come back negative. Or I might turn around and say, so there's a number of possibilities this could be. The biggest thing in my mind that I think this is probably related to is probably anxiety, because there's a lot of things going on in your life, isn't there? Had you thought the two might be related? You had, yeah. I think that's probably what's going on. Now, you said that you're a bit worried about your heart, and especially with your dad dying, dad having a heart attack young. And I don't think that's going on, but we will make we'll do a couple of tests just to make double sure. Just to make double sure. Do you see? Just to make double sure, saying I don't really think that, I'm just being cautious. All right. And also we talked a bit, the other possibility is whether there's a clot in the lung. To be honest, I don't think that's happening with you, but we're going to examine you anyway, and the doctor will probably know whether that's the case or not. But I have a feeling it's not. That's how we do it. Do you see the way in talking about any condition, you already beef it up? All right. So if you don't feel it's the big thing, push it back down again. So in this case, I'm not thinking of PE, but I feel I have to mention it. All right. So you said that also the the sharp chest pains. One of the other things we sometimes worry about is clots in the lung. Now, I don't think that's what's going on, but what we'll do is we'll get the doctor to check you over, and hopefully that won't be the case anyway. All right. So do you see, by talking it up, you're putting it on, if you imagine a theatre, you're putting it on the front center stage, aren't you? You're beefing it up. So if you do talk about something, you can push it back down by saying, but I don't think that's what's going on. Or just to make double sure, we'll do that. But I expect it to be okay. But I'm hoping it will be okay. So in the situation where you've got several differential diagnoses, they're all going to have some sort of order. You're going to think this one first and these ones later. So what I'm saying is explain that one first and still explain the others, but don't give them the importance as much as the first one. Sometimes, however, you might have 4 things, and the first 2 are almost as equally important, but the others are less. So explain the first 2 into some detail, and don't explain too much about the others. A good example of that is shortness of breath. You may actually say, I know you've got COPD and I know you've got heart failure, and I don't know which of the 2 is triggering this off. And it could be a combination of the both, So sometimes you have to explain 2 of them because both of them are equal importance. Are equal emphasis than the others. And in that case, you wouldn't talk about a PE because you don't really think that. Do you see what I mean? Yeah. Or it might be an infection. And sometimes you can have 3 things going on. Well, Mrs. Such and Such, it's really difficult for me to tell. You said you're bringing up a cough. There's 3 things going on because you've got COPD and you said your ankles are swollen up. I don't really know whether this is related to your heart or whether it's related to your COPD. But the other thing you said is that you're bringing up a cough and it's dirty, so you may have an infection. So actually it could be any one of these 3 things, to be honest. All right. And in that situation, it's very difficult to come off the fence. Wouldn't you agree? Yeah. In that situation, I might say, to be honest, I don't know which of these 3 it's going to be. And that's why I think it's really important to examine you. Why don't you come in to examine? Because then we will know whether you've got an infection or not. because we could hear it on the stethoscope and you may have a fever. But if the doctor doesn't think it's an infection, then we can focus on either the COPD or the heart failure. And listening to the chest should help us determine that, because sometimes you can listen to the heart failure on the chest, and certainly if your ankles are swollen, it might go that way. Or we may need to do a blood test to see if it's a heart failure thing. All right. Now, if they came back as normal, then it might be your COPD. But there's part of me thinking that it might not be your COPD, because you said you recognize when your COPD is going off, and you just feel that this isn't. All right. Do you see there the emphasis? I've explained all three of them to roughly the same, but perhaps a COPD slightly less because the patient doesn't think it's a COPD. Do you see what I mean? Do you see the way it works? It's not, there's no magic formula to this. I don't want you all to be going home thinking, I'm just going to do this, 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 this. Here's a formula to follow and I will pass. It doesn't work like that, because general practice doesn't work like that.
Is it in all cases you have, like, if there's a case that you know your diagnosis is like, your tentative diagnosis is 100% or 98% one thing,
Yeah.
and the other one is really, really, or you don't even have any other diagnosis. Is that correct, not to have another thinking of what it could be? It's just one thing running through your mind and just.
Okay, so actually, if I've heard your question right, Warola, what you're saying is that what if you have a diagnosis that you're 95% sure of, why talk about anything else? And actually, you might not even think about anything else. So why not just talk about, is that what you're saying?
Yeah.
You are right. There are lots of situations where you've got several differential diagnoses. There's lots of situations where you've only got two differential diagnoses. And there's a lot of situations where you've only got the one diagnosis. All right. Then in that case, explain that one thing. Don't explain anything else. So for example, look at this situation. So tell me more about your headache. All right. Okay. So in summary, what you're saying is that when this headache comes on, you have to lie down and close the curtains here. And there's you feel terribly sick with it sometimes. Okay. Yeah. And this has happened a number of times now, and you've never seen anyone about it, right? How long has it been going on for? 4 years. And you've never come. Why did you come this time? I just got sick and tired of it. Right. Okay. And so the headache's on this side. It's sometimes you can tell it comes on because your vision goes a bit funny. And then what usually happens is you have to go to the bed, and then over the next 3 or 4 days, it goes away. And there's sometimes a lot of vomiting with it. And sometimes you feel terribly sick, and your hearing goes a bit sensitive. Yeah. Okay. In this one, you can almost guarantee that this sounds like a migraine, doesn't it? It's a classic. So you may just explain the migraine. All right. But if you started giving features of intracranial pressure, then you might say, well, it sounds like a migraine, but I just want to make sure it's not got this. And in other situations, it might be that the headache's showing more features of intracranial pressure than the migraine. It could be a migraine, but actually there's more of that. So you explain that more than the migraine. That's not to say you still don't explain the migraine. You still explain it, but just a lot less. All right. This is such and such. This could be a migraine, but the thing that worries me is that you said you're vomiting all the time. Your vision's going off, and sometimes you're seeing double vision. That is a bit more unusual with a migraine. I mean, it still could be, but I'm really, really worried in case there's something else going on. Like what, doctor? Like something in your brain? Oh man, you mean? Yeah, I'm afraid so. Let's get something right. I'm not saying you've got anything going on in your brain. You can't tell that until you get your MRI scan. All right. So I don't want you to go home just worrying to death about it, because we have to wait on the MRI scan. Hopefully they won't, but I would be silly not to do that scan. I do need to do that scan to make sure nothing's going on. Fingers crossed it will come back as negative. And if it does, then we'll go down that migraine route. Can you see how I've explained that? Can you see the different levels in which I've explained that? Oh, by the way, coming off the fence sometimes also means sometimes you might sometimes you might follow guidelines and sometimes you might not. Remember, guidelines are guidelines. They're to guide you. They're not protocols. They are there to guide you, not to force you. So sometimes you may not follow a guideline. So if you're not following a guideline, do come off the fence. Well, normally we wouldn't do this, but I'm thinking of doing this in your case because explain it. Yeah. And it's okay to do that if the justification meets up.